Guys, welcome to my channel. So if you have been suffering from piles or hemorrhoids, this video is for you. So piles can be a pain in the butt. If you've had it or if you have it, you will know exactly what I'm talking about. They're a pain in the backside, and it takes over your life because you're constantly in pain. You can't sit, you can't stand, you're either bleeding, it's itching, and all the discomfort that comes with piles. So some time ago, I was in hospital. I had to stay in hospital for quite some time, and as a result of that, I was giving some really strong analgesics, some strong painkillers, and that caused severe constipation. So when I got home, I really struggled with piles. I've been back and forth to the doctors, and nothing has really helped. They've given me loads of creams. I've tried them all, nothing. And it just seems to be getting worse. And one of the other treatments that was recommended was for me to have surgery. But you see, I am not a big fan of surgery. And also, I know someone who had surgery to treat their piles. And unfortunately, it got worse. So it didn't really treat the piles. It got better. And after a few months, it was twice as bad. So I thought, no, I am not going through that route. Okay, the doctors couldn't find me a solution. So I had to take matters into my own hands. I came across a natural home remedy, and this has been like a game changer. I will show you. It's literally just three ingredients. But before I get into the actual video, just a bit of background about piles and what you can do to avoid having piles.
Piles or hemorrhoids are lumps or enlarged blood vessels that you get inside or around your anus opening of your bottom. Every human has blood vessels in their anus, as these play a crucial role in continence. But piles can develop if these blood vessels become enlarged, therefore becoming very painful and irritating. So there are two types of piles: internal piles and external piles. Internal piles have 4 different grades: first, second, third, and 4th degree piles. With internal piles, they start from inside your anal canal, but some of it might hang down and come out of your anus. They are then graded according to if it comes out or how far it's come out. So with first degree piles, these bleed but do not come out. And second degree do come out when you have a poo, but they go back inside on their own after. Third degree do come out and only go back if you physically push them in. And with 4th degree piles, these always hang down from your anus and can't push back. They become swollen and painful if the blood inside do clot. So with external piles, these are piles that are swellings that develop further down your anal canal, closer to your anus. They can be very painful, itchy if the blood clots inside. It is possible to have both at the same time, and you do not want that. Both types of hemorrhoids can prolapse or stretch outside the anus. So what are some of the risk factors, or who is at risk of developing piles? Anyone basically can get piles, and your risk increases if you're overweight, if you're obese, in pregnancy, or if you don't do enough activity, if you don't eat enough fiber and you develop constipation, or you're straining while going to the toilet. Certain medications can also cause you to have piles due to constipation, which is what happened to me. If you have a persistent cough, or if you're lifting heavy objects, so these things can cause you to have piles.
So what are some of the symptoms of piles? Well, piles don't usually cause any pain or symptoms, but if you do have symptoms, they might include things like bleeding. When you poo, you might find bright red blood on your tissue paper or in the toilet, lumps in or around your anus, slimy discharge of mucus from your anus, and this might stain your underwear. Something to be mindful of. Feeling of fullness and discomfort in your anus, and also feeling that your bowels haven't really completely emptied itself after you've gone to the toilet. You might also have things like pain and discomfort after you go, and also some uncomfortable itch. This can be quite irritating, and these symptoms can vary between individuals. But if you have any of these symptoms, I will highly recommend you contact your doctor.
So, how is piles diagnosed? Well, if you notice any of the above symptoms, your doctor can diagnose this by giving you a physical examination. They may gently put their finger into your anus to feel your rectum. They will do this by wearing a glove, of course, and use a gel to make it more comfortable and less painful, but it can be quite irritating. Your GP might also refer you to a specialist doctor who can then look inside your rectum using a short, rigid tube like an instrument called proctoscope. You might also need to have a blood test to check if you have anemia, as the bleeding from the piles can cause anemia and cause you to lose a lot of blood. So, how do we treat piles or hemorrhoids? Usually, they go away on their own or without any treatment. There are many over the counter products to ease the pain, but I will recommend you speak to your pharmacist or your doctor to give you the best options available. Also, drinking plenty of water, usually 2 to 3 liters of water a day, will help keep your stool soft and prevent things like constipation. Increasing your fiber intake is very important. You should normally eat more fiber-rich foods. Fruit, whole grains are usually the most important thing you can do to yourself to prevent piles. What I tend to do is I eat a lot of avocado, and I've found that they help me go to the toilet. I mean, normally we should go to the toilet after every meal. So, which doesn't happen to everyone, I know that, but you should try your utmost best to have a fiber-rich food. And also, some people do have fiber supplement, but I will highly recommend you speak to your doctor or your pharmacist before you start taking any supplements. Being physically active, it's also very important. Also, another thing that is recommended for treatment is surgery. A lot of people have had surgery for piles. I know a few people that have had it, but it's not my favorite because it is very invasive and it also comes with complications. Unfortunately, some of the people that I know that have had surgery, the piles have come back after some time, so it hasn't really treated the piles and it's come back with other complications. That is the reason why I decided to do my own home remedy, and I found that this has treated my piles and my piles have gone for good. So I highly recommend you trying my recipe. So all you need is 3 ingredients. I've got some garlic, some extra virgin oil, and some thyme. So guys, this is all you're going to need. And then I've got this. I will be showing you what we will do with this in a minute. So what we need to do first is to put our garlic to boil. So all you need to do is to peel your garlic. Yeah, make sure you remove all the skin. So it's important to boil the garlic with the skin. There we go. So now you're going to crush it. So just crush your garlic. Right, so just put a little teaspoon of olive oil. And some thyme.
And all you need to do now is to mix it properly. So this is my mixture. So what you want to do now is to get a little pad. So I just got these from the drugstore. So all you need to do is just to put some onto here like this. So if you prefer, you could press the garlic a little bit more, but I found that it worked better when I didn't crush it all the way. So you can put a small bit like this and just drop your pans down and put it on top of the pile to sit there, and you can change this about 3 times a day or however many times you want it, and just give it a couple of days and you will see the magic. This right here was a game changer for me.
I hope this video has helped you, and please do not forget to share and subscribe. Thank you for watching. Goodbye.